Houston market, we have several zip codes we know that have much higher rates of morbidity and mortality in particular. And when you really look at those zip codes, they have very few, actually have no resources. And so one of the things we as Memorial Hermann, we really want to focus on making a healthier community overall, but especially for my service line, really having healthier outcomes for our women, is we were trying to figure out how is a way that we can provide those services and touch every woman in the Houston market. And using technology, although it isn't always accessible right away for each woman, because although most people have phones, not everyone does, but it is also a tool we're partnering with some of the community health resources that are out there, like our federally qualified health centers that are trying to tackle some of these zip codes, is partnering with them through the use of technology so that a woman's healthcare journey isn't disjointed. So she's not going to this provider for this part of care and this part here, and so records aren't being shared, information is not being shared, which actually, even though she's seeking care, she's not getting the optimal care that can improve her outcome.
When I think about the care team in the maternal health context, you have prenatal care, right? You have labor and delivery. You have wraparound maternal health systems like doulas and midwives and birthing centers. You have commercial insurance and Medicaid managed care. Medicaid, frankly, is funding more than 50% of the births in our country at this point. And when you take that into the context that a number of these complications, frankly, are also driven by social need, and it's this notion of your zip code being one of the higher predictors of your health. This has been one of the most fascinating and I think rewarding things in my time with Babyscripts, is seeing the various resources that people want to bring to bear, but oftentimes ends up being a tree falling in the woods. I'll give a wonderful example where through our platform, we're routinely having moms provide various assessments to uncover unmet need or rising clinical risk. That could be a mental health assessment, a social needs assessment, a health history or symptom assessment. And so we start to look at these social needs, and you could be talking about food insecurity. And then I start to get to work with my managed Medicaid customers, and I find out that they'll offer 3 square meals a day drop shipped to their patient's door or to their member's door, but they don't find out that they have a pregnant member until oftentimes the 3rd trimester, sometimes after labor and delivery. And so we have this unique vantage point of a digital platform that's kind of reaching into these various elements of the healthcare ecosystem and saying, wow, there's a need over here, and I happen to know that our partner has a solution over here. And I think that's a lot where we're taking our business, is to continue to identify ways to continue to uncover more unmet need, rising clinical risk, and then close the loop through this digital platform for that expectant mother to be connected with the most appropriate resource best suited to fulfill said need or mitigate said clinical risk.
I looked at Babyscripts probably 6 years ago to start with, but we also looked at the other competitors out there in the market and came back to choosing Babyscripts because we really felt it would help align with our system's journey of this personalized medicine. The priority was to really look at it from the patient's point of view, maybe make it easy for her to use, but providing her in step 1 is educational tools. So she can feel comfortable using the Babyscripts app to find out about where she is in her pregnancy, what she should be doing to keep herself healthy and have a healthy pregnancy, when she should be calling her doctor, what to expect. And it's information that will align with her when she sees her OB clinic. She's not going to find out, why is he saying something different than I just read? And so she's getting the right information, as well as personalize it for the Memorial Hermann experience by letting her know if she has to go to Memorial Hermann during her pregnancy, where she will go, what the experience is, what her copay, what those type of things to educate her. In addition, we're going to be collecting sociodemographic data so we can kind of identify moms that may be at higher risk. So either our nurse navigator can reach out and assist her with those needs, because sometimes women are afraid to speak with their OB providers about some of the needs that they may have. And then as we evolve this, our next step is going to be our remote patient monitoring journey, as Drew said, so we can really help provide services in the home and make it, again, this is a population that wants things at their fingertips. And so for some women, it's the right thing to do, and they can have access to some of these tools in their home so they can feel like they're having a safer pregnancy. But especially for the providers, they can kind of monitor when they do see the mom starting to develop some risk during her pregnancy, that they can monitor her safely at home and get real-time data back and not have to rely on making sure she comes in for that follow-up visit right away. She can't always get into the office. And then also, as you said, with the, working with the payers is, as I said, one complaint they've always said to us, they don't recognize that their patient is pregnant until almost the end of the pregnancy. And they do have some programs that may be also complementary to everything else that the mom can get, so we can kind of identify that early and feed it back to her insurer if she so desires to participate in that other level of maternity care that the insurer can help her with. So we're hoping, the goal is to have a healthier pregnancy with a better outcome, to decrease those moms that wind up needing a high level of care and decreasing those NICU admissions.